Takotsubo cardiomyopathy, also known as broken heart syndrome, apical ballooning syndrome, stress-induced cardiomyopathy, or just Takotsubo, is a temporary condition where the left ventricle of your heart changes. Shape gets larger and suddenly becomes weakened. The left ventricle is one of the 4 chambers in your heart that pumps blood to major organs and other parts of your body. When the ventricle becomes weak, it doesn't pump blood to the rest of your body as well as it should. The cause of Takotsubo is not fully known, but it's usually triggered by severe physical or emotional stress, such as sudden illness, grief, intense fear, a serious accident, or a natural disaster, such as a hurricane. Experts think that a sudden large increase in stress hormones may lead to changes in the heart, muscle, or blood vessels, or both. These changes interfere with the left ventricle's ability to pump. The symptoms of Takotsubo are similar to those of a heart attack. However, most people have no major blockage in the arteries. The most common symptoms include chest pain or discomfort called angina, shortness of breath, sudden onset of fatigue, heart palpitations, which is the feeling that your heart is beating faster or pounding, sweating, lightheadedness, and fainting. A shocking fact about Takotsubo is that 9 out of every 10 cases occur in women ages 58 to 75. It's more likely to happen in women who are past menopause, especially after age 50. And research suggests that up to 5 out of every 100 women suspected of having a heart attack actually have Takotsubo. To diagnose Takotsubo, your healthcare team may use a few different tests, including a heart angiogram to look for blockages in your arteries, an electrocardiogram or ECG to look at the rhythm of your heart, or an echocardiogram to see if your heart wall is moving normally, as well as blood tests. Because the symptoms of Takotsubo and a heart attack are so similar, these tests are done to make sure the event wasn't a heart attack. Treatment for Takotsubo is very similar to that of a heart attack and depends on your symptoms. Treatment can include support for taking your heart medications as prescribed, getting active, eating a healthy diet, getting mental health support, and learning how to set goals for your health and recovery. Most of the abnormalities in the heart function go away in 1 to 4 weeks. Most people who have Takotsubo recover fully within 2 months and are at a low risk for it happening again. However, some may continue to have signs of heart failure with fluid collecting in the lungs. Each patient's recovery from Takotsubo is different, and it's important that you follow a treatment plan that is right for you. To start, take your heart medicines as prescribed and regularly, and attend scheduled visits with your healthcare team. These actions can help reduce the risk that you will have another health problem months or years after the first Takotsubo event. If you are recovering from Takotsubo, ask your healthcare team about joining a cardiac rehab program. Cardiac rehab is a proven way for you to improve your heart health and reduce the chance that you will have another heart event. It can also be a way to meet other women who are recovering from a similar condition and receive the emotional support that you need for your journey to better health.